your party put out an ad asking Canadians to give them credit for the healthcare system that they are enduring right now. And I put to you, I don't know any Canadian who thinks that they have a level of access to that healthcare system that is anywhere near satisfactory that they should in turn be giving you credit for.
Mark Holland sat down with Vassy Kapelos to try to convince everybody, including himself evidently, that healthcare in Canada has never been better. However, by all accounts, all Mark served to do is demonstrate how desperate the Liberals are for Canadians to believe their lies.
Let's take a look.
Liberal MPs in the House of Commons there today marking that more than 1 million Canadians have now received dental care under the federal program. The plan is also expected to expand to more Canadians next year and features heavily into a new ad just released by the Liberals. Take a look.
Pierre Poilievre has made it clear that he would make cuts to all these investments, removing healthcare services from millions.
The ad is focused, as you saw there, on the issue of health care and comes a day after the Liberals, which have trailed the Tories by between 15 and 20 points in public opinion polling for the better part of a year, heard from their new campaign director. Mark Holland is the health minister. He joins me now to talk about all of that. Hi, Minister. Good to have you here on the show. Thanks for making the time.
Thanks for having me back, Vassy.
I want to start off on the ad and then ask you questions about the rollout of dental care into next year, and primarily the ad against the, that we just played, the focus being on health care. In 2019, your party pledged in your election platform to, quote, make sure that every Canadian has access to a family doctor or primary health care team, improving the quality of care for the nearly 5 million Canadians who today lack access. According to the Canadian Medical Association, Minister, today 6.5 million Canadians lack that very access. Why are you trying to get Canadians to give you credit for a situation that has worsened under your watch?
Great question.
Well, it's especially a great question because I watched that Liberal Attack ad. And in the Liberal Attack ad, it says, we've hired all these doctors and provided better access to doctors. And it's like,
not from what we've heard. We are fortunate enough to have a family practitioner. And one of the reasons why we have stayed put and not moved, because we have considered moving to a more rural location. But the reason we've stayed is because we don't want to lose that family doctor, especially for our son. Our son needs access to healthcare, and the family provider is that first step in getting that access.
And, surprise, surprise, you bring in millions and millions of people and you don't add enough doctors. Guess what's going to happen? More people are going to be without a family doctor.
Well, and it creates a huge problem because I can't speak for other provinces. We're here in Ontario and that's what I can speak for. But in Ontario, at least, your family doctor is the stepping stone to getting care elsewhere. You need a family doctor first, then you can get a pediatrician. You need a family doctor first, then you can get a cardiologist or a psychiatrist or a gastroenterologist or whatever specialist you need. It's extremely hard, if not impossible, to get a specialist without having a family doctor first.
Yeah, the only real possibility that you can is if you have a medical emergency, you're in the emergency room and then they, do a referral there. But otherwise, there's no chance. It's a barrier to actually, taking advantage of the rest of the healthcare system.
Well, first of all, we had the pandemic, and that was devastating, not only to our health system, but every health system across the world. Canada had a better pandemic response than just about any other in the planet, with one of the lowest death rates, and has been the quickest, one of the quickest to recover in terms of surgical wait times and number of surgeries performed. In fact, we have the baseline report from CIHI, which administers data that's showing not only that what I'm talking about, surgical backlog, but that in nearly every province and territory, we are now gaining doctors, gaining nurses. And that's before our bilateral plans kick in. Now, we've signed a bilateral plan with every province and every territory that's $200 billion. So that baseline is showing movement before we get there. But I can tell you that the only way we're really going to solve this is being upstream. 70% of chronic disease and illness is preventable. That's why things like dental care, pharmacare, school food, integrated data, and these bilateral agreements, to name just a few, are so essential. We cannot afford to not take action, not only because of the disease that will happen and the illness, but also because the cost is absolutely unbearable. We need to be upstream. We need to be investing. We certainly shouldn't be cutting.
Okay, but just to parse apart what you just said there, are you actually arguing to Canadians tonight that they should be happy that some baseline has been returned to? I cannot imagine there is a single Canadian watching the program tonight who feels like their access to healthcare has improved under the last number of years. And you referenced those bilateral deals. I mean, they were signed well over a year ago. If they are so effective, why aren't they yet working?
Wow. You know, I would not want to go up against Vassy. It would be entertaining to watch myself afterwards and be like, oh man, look at these stupid answers that I gave. But like, she goes like really hard.
Well, and you know, she makes mistakes sometimes, and we will call her out on those. But we will also point out the fact that she does go hard after the Liberals. Now,
everybody, she goes hard after everybody.
And that's the thing. And some people, I think, it bothers them when she goes hard after, say, Andrew Scheer, and some people will say she goes harder after Andrew Scheer than other politicians. I don't think so. I think she goes.
I think she's pretty
consistent.
good with everybody. If you give a lot of stupid answers, she's going to give a lot of pushback. But if you're straightforward, I think she'll just go with it.
Yeah. So you know, Vassy is saying what we're all saying when the Liberals are saying all this crap, right? It's like, are you seriously sitting here saying that the healthcare system is magically transforming into this, you know, health utopia?
Well, they're trying to say that, oh, things got hard after COVID, blah, 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 but now we're back to baseline. We're back to baseline, and over 6 million Canadians do not have a primary care physician.
We're actually worse off.
Yeah.
Like, so, no. And ask any Canadian waiting for surgery. Give me a break. Some Canadians are waiting years.
Right. I mean, you were relatively lucky in that they put you on a cancellation list and you only had to wait about 6 months from the injury date to the actual surgery date. But 6 months is still way too long.
Yeah. And I'm one of the lucky ones, because there's people that were injured before me and they are still waiting for surgery.
Well, and there's people with conditions that are potentially fatal that are waiting. I mean, at least your knee being injured was not going to kill you. It was an inconvenience, absolutely, and you were in a lot of pain, but it wasn't going to make you drop dead.
Well, and there are stats out there that show that Canadians have actually died waiting for surgery. It is atrocious. Absolutely atrocious. And then you have these guys trotting out saying, oh, well, you know, we've invested all this money, and yeah, like, the problem is whatever the Liberals touch, it turns to ash. That's what they've demonstrated. Nothing works when they touch it.
Well, in the first order, as I said, I met with my G7 counterparts. I don't think anybody should be happy with the health challenges coming out of the pandemic, Vassy. I think the fact that we had one of the best responses and that we're bouncing back faster than just about anybody else, no one should be happy with that. But I mean, as health minister, it's the heaviest thing that my heart has, to go and meet people who are ill or aren't connecting to care. But the question is, what are you going to do about it? You know, what are you going to do now that we have this circumstance coming out of the pandemic? You talk about the bilateral agreements. The baseline data I'm talking about captured a year ago. It takes about a year to be able to see that. And anecdotally, we're in a very, very different place than we were a year ago, and improving all of the time. And that's because of our investments. And as I said, you know, take 1 million people, Vassy. 1 million people in 6 months have been connected to oral health care. That's going to cost us about $2 billion a year in emergency room visits for people to go in with oral health issues. Now they're going to get preventative care. That's going to have a huge impact on our health system and on waiting times. We need diabetes medication, the same thing. When people don't have access to their diabetes medication, they get very, very sick. They wind up in a doctor's office. They wind up clogging up emergency rooms and hospital beds when they don't need to be there. And I could go on and on and on. We need to be upstream. If you come in and the solution is to say, wow, it's a tough world, why don't we cut it and make it worse, then the Conservatives have got a plan for you. But what we're saying is
But that's not what I'm presenting to you, Minister. With all due respect, I'm not saying this is a binary choice between cutting and not. Your party put out an ad asking Canadians to give them credit for the healthcare system that they are enduring right now. And I put to you, I don't know any Canadian who thinks that they have a level of access to that healthcare system that is anywhere near satisfactory that they should in turn be giving you credit for.
Wow.
Boom.
She's on fire tonight.
Like, how do you like that again, Mark Holland? Like, come on.
You know, this is what happens when you have ministers bouncing around from portfolio to portfolio. I mean, at least with the Conservatives, their shadow minister of health is an actual doctor.
Yeah, this isn't Dr. Mark Holland, but we have a Dr. Stephen Ellis. Like,
We sure do. And he's going to make a fantastic health minister for this country.
100%. 100%. And you know, he's not a doctor with a PhD like some other doctors are. Not taken away from them.
No, he's a medical doctor.
He's an MD.
Yeah.
So, you know, so he's the right guy for the job. Gee, imagine a cabinet that actually had people that were in the proper positions according to their qualifications.
Must be a conservative idea because it makes sense.
Very strange. But this is the thing. And again, I go back to the book, 1984, where, you know, yesterday they say, oh, chocolate, you know, was
30 grams.
Was 30 grams. And today, chocolate has now been increased to 20 grams. And then everyone's like, what? But it's less. But then you said we've increased it to 20 grams per ration. What? Liberals are doing the same thing. Same thing. It's called doublethink, where they actually give you worse news, but tell you that it's actually
better.
improved, and then it tweaks your mind. And your mind actually short circuits, and then you don't really know what to believe, so you just go with the latest statement that they give. So this is crazy that we're seeing 1984 marketing play out in real time in Liberal attack ads.
But what I'm saying, this isn't about credit. I mean, I appreciate maybe that's how you're thinking about this. It's not how I think about it. I think about it in terms of
what's the
progress
ad
and
for?
solutions. And I can tell you that what we're doing on dental care, on pharmacare, on school food, on the bilateral agreements, on interconnected data, and I could go so much deeper on each one of those, but we have a short show. When you talk to people who are health experts, they have an enormous amount of optimism because they see that we're doing what needs to be done, not just to stabilize a health system, but completely transform it. I am absolutely hell-bent on transforming our health system to make sure we go from a system of illness and disease and waiting for people to get sick to a system of prevention and wellness. Do you know that Canada, because you talk a lot of negative facts, Vassy, did you know that Canada has one of the longest health spans in the world? And what's a health span? That means years lived healthy. We're 6 years better than the United States, 2 years better than the United Kingdom, 1 year better than France and Italy. We have one of the best in the world. We're doing lots of good things. So you can point to one element of the health system. What about oncology? You know, when I go walk into a sick kids hospital out in BC, and I talk to the oncologist there, when an oncologist started their career, 90% of the kids who walked in that door died. Now it's 30%. And by the way, it doesn't cost them a cent. So allowing Pierre Poilievre to attack the things that are working by allowing him to cut the things that are working doesn't allow us to focus on transforming the system and making the investments we must make, Vassy, to transform this health system.
Yeah, and certainly I don't think me highlighting a lack of access to primary care is dismissing advances that have been made in healthcare in this country. I ask you again, in all honesty, are there Canadians that come up to you and tell you they're satisfied with their ability to see a family doctor? That is the promise your government made to them in 2019, that access to primary care would expand and improve under your watch. The opposite has happened. You're blaming COVID, just like the immigration minister blames COVID, the housing minister blames COVID. You know, I get it. COVID was a big deal. But it's being over for 2 years, and you are asking Canadians to give you credit for those improvements with this ad. Why else would you put out an ad?
You're thinking about credit. I'm not interested in credit.
You know, and I kind of find it insulting the way that Miller was throwing around these numbers, like, oh, well, you know, 90% of children with cancer used to die in this hospital when we spoke to the oncologist, and now it's only 33%. I mean, medicine gets better over time. We learn more, we develop more, we innovate more. And I believe that these stats would have a lot more to do with just the amount of time and the amount of innovation, as opposed to like the number of doctors or whatever Miller is trying to claim. I mean, look at, before we had insulin, children who were diagnosed with type 1 diabetes were literally just like on their deathbeds
death
in the
sentence.
hospital ward, and the parents just waited around for them to die. And that was the harsh reality of diabetes. And then doctors Banting and Best, 2 Canadians, by the way, created insulin, and it was a legit miracle. Like, parents, it was no longer a death sentence for their child. They were no longer waiting around for their child to die. These kids could live full, healthy lives now.
Well, it's the same, you know, when AIDS was a death sentence, right? You know, if you contracted HIV and you developed AIDS, it was a matter of time. And you don't hear about AIDS anymore because of the advancements in treatment that they've actually been able to allow people to manage it. So, but the other morbid fact about this is talking about those percentages, Mark. How many kids don't get to go through a front door because they don't have a family doctor, and this isn't detected until it's too late, and then those children end up tragically passing away before they even get to the hospital in the first place.
Well, and not just children, but Canadians
Everybody.
in general. Like, over 6 million Canadians do not have a family doctor. So that's 6 million plus Canadians who don't have access to that primary care that a doctor might be able to, you know, look at them and make sure that they're okay, that if they have something bothering them, they could check. I mean, I look at myself, for example, where I was having the worst migraines for no reason, all the time. And so I went to my doctor, and it turned out I had high blood pressure. Like, had it continued, I could have had a stroke. So because I had that primary care physician, she was able to detect something early and get it dealt with. I mean, how many Canadians don't have that opportunity? Well, we've heard it's over 6 million.
Well, and as Vassy says, and I love that she called it out, she said, you, Mark Miller, and Stephen Fraser, all of you are blaming COVID now for what's going on. You blame the Conservatives for as long as you can. You blame COVID for as long as you can. And the situation on COVID was self-inflicted. You created that situation in terms of the response that caused all of these problems. And now you have hundreds of thousands of Canadians or new Canadians coming into this country every single year. And that is exacerbating the family doctor problem, because they don't exist. And you want to put in capital gains that is going to affect their retirement and causing the doctors to say, screw this, we're done. So you are effectively collapsing our healthcare system. Yet you're telling every Canadian, we did a great job, guys. Give us some credit. And so I love that Vassy is calling it out and saying, no, bull. Absolute bull.
Look, I was head of the Heart and Stroke Foundation.
What's
I've spent
he
my
out for?
entire life advocating for changes to our health system. You seem to be very fixated on credit. I'm not interested in credit. I'm interested in improving the
You
system.
put out an ad
and what
asking
are the
Canadians
solutions?
to support your party because of health
But
care.
Vassy,
That's asking for credit.
But Vassy, listen to me. But Ashley, no, what it's asking for is to continue progress.
She's like, why did you put out the ad?
Well, we don't want credit. Then why'd you put out an ad? And why did they put out an ad? I suspect that there's going to be an election in our near future.
Well, the problem is they need to, even if the election is next October, they need to be putting out ads now. That's the problem.
Yeah, but how can they go a full year nearly with the House seats? Like, the Conservatives are not going to let go of that. Nor should they, because they're holding the government to account. You guys give over the documents to the RCMP, we will stop our filibuster.
Well, they just have to wait until February of next year, and then the government will fall, because then Jagmeet will have his pension. So they're probably timing that for February.
What it's asking for is to say that, yes, Vassy, this was the largest event since really World War II that disrupted the entire global circumstance. There isn't you tell me a health system that wasn't rocked by the pandemic. And we came out it faster and better than anybody. And we're one of the best, absolutely. Surgical wait times in terms of turning around the health workforce issues. So, yeah, I mean, I suppose if you said, well, let's pretend the pandemic never exists, that, that we should be held to some kind of, like, what I'm saying is I can give you a clear plan. And unfortunately, this format doesn't allow us to go deep enough. But let's talk dental care. Let's talk about Dr. Redmond, who is in Gander, who in just the last number of of months, his team has identified 3 oral cancers because of the Canadian Dental Care Plan. Those are cancers that would not have been identified if we didn't have preventative care. That's what Pierre Poilievre would cut. You want to talk about diabetes? Costs this country $30 billion a year. Pierre Poilievre will stop our ability to get diabetes patients medication. That's going to cost this country an untold billions of dollars, and it's socially unjust that somebody should go blind or should lose a limb because they don't have access to the medication they need. That's what's at stake. So you talk about credit. I'm talking about people's health. I'm talking about people's lives. I'm talking about progress in our health system.
Right.
I'm talking about making sure that we build on one of the best health systems in the world, and I'm here to fight for it, Vassy. And so you're talking about credit. I'm talking about fighting for what I care about.
I mean,
right. So why would
an
we allow
ad
Pierre
put out by
Poilievre
a
to cut
political
it?
party.
Right? Why would we?
Yeah, but an ad put out by a political party is hoping to advance the cause of that political party among Canadians. You are hoping by putting that ad out that Canadians will respond to it and say, you know, we want you to stay on this track. We are giving you credit for where we are right now. And I'm putting to you that despite all the stuff that you just laid out, which I agree, look, there is expanded access for people with diabetes and under dental care. I would not take away from that. There are still major, major issues in this healthcare system that you have presided over.
I'm going to correct Vassy yet. Nobody has access to this diabetes medication.
No, not yet. And again, it's only 2 classes or 2 sets of medication, I suppose you could say, for 2 conditions. Number 1 is birth control, and number 2 is diabetes medications.
And this is the gaslighting from Mark Holland, because he is citing the total cost of all Canadians with diabetes. But you're not treating all Canadians with diabetes. You're only treating Canadians with a subset of medications that you're approving for.
Well, and I just want to throw this out there again, because we've spoken about it in the past and we've received comments and emails that it's been helpful for people. So it's important to know that your province and territory already has a drug plan in place. There are certain criteria, and it's going to depend on the province or territory that you live in, whether or not you qualify. But I'm going to put a link in the description, and if you're having trouble affording your medications, definitely check it out, because there already are programs in place. And check out that link for your province or territory, and you can learn more as to whether or not help is available for you specifically.
Like we needed to get some medication for my son because he had an infection, and I asked, how long is this good for? Up to 25. Thank you very much. So that's the Ontario drug plan.
Well, I think the Ontario one does all kids under 25, regardless of economic status, but there are programs for adults as well, and that's why I'm going to put the link in the description. You can check it out if you need to, and see if you qualify.
But I mean, you make a fundamental mistake, with all due respect, Vassy. I joined the Liberal Party when I was 12 years old. I started investing my life, and people looked at me weird. My mom gave me a packed lunch, and I went to volunteer in a campaign office. And like so many people in politics, I went in because I believe in this country and I believe in trying to make it better. Look, there's many things that I or anybody in politics could do. The reason I'm not on Halloween tonight with my family, being there for my family that I love, is so that I can fight for the kind of future I believe that they should have, the kind of country that we should have, one where we get to live free of disease and illness, where we attack illness before it happens, when we're investing upstream. That's what I'm here for. That's what I'm in it. You want to call it credit? Like, I'm going to be forgotten, Vassy. 5 years now, I lost. I know this. Once the title's gone, I'm forgotten. No one's going to remember me. But what I'm going to know in the depths of my heart, in the moments that I had, is, did I deliver for Canadians? Did I get it done? Did I improve care?
And I think it's fair for somebody to ask you about the areas that you haven't delivered on. Yeah, and I'm not taking away from your motivation.
Totally
I would never ascribe motivation, but I think it is fair to ask the person who's in charge of the healthcare system across this country about the areas in which it is lacking. That's all I'm trying to do. And in that vein, I do want to ask you about dental care before I let you go, because I want to ask about access, because you did, and we played the clips earlier, talk about how there are, 1 million people who have now accessed that system, and next year there are going to be millions more who will essentially be eligible. I listened to your press conference today, and there were a couple questions about how soon that will happen, because the Minister Beach had at one point last June said that in January, the rest of those Canadians would be eligible to apply. You seem to not be willing to commit to that January date. How soon in 2025 might those millions of Canadians be able to apply for this access?
All right. You know we hate doom and gloom. But I want to raise a realistic possibility. So as the Liberals continue to spend money with reckless abandon, and let's say they open up dental care for everyone, what happens when there's not enough dentists for all of these Canadians?
I think my main concern is going to be if they make dental care available to all Canadians, what happens when employers go, well, I guess I don't have to pay for that anymore for my employees?
Right. And remember, this dental plan does not pay for everything. Despite them promising this for over a year, they kept saying free dental care. I'm not going to play the clip, don't worry. But they kept promising this. And no, it is not. It is not a completely, free program. So that's the question. What happens? What happens when you need braces? What happens when you need major surgery? What happens when you need anything? And what happens when all of a sudden you see these dentist wait times starting to creep up? That's the question.
Well, one of the reasons we've got this last 6 months so right with so few problems, and we have 89% of oral health providers now participating, 1 million Canadians getting care, is because we were methodical and we make sure we got each step right. The next step starts tomorrow. It's a big one. We're expanding care to the more complicated cases. We call this pre-authorization, predetermination. So these are really complex cases that really need additional care. That starts tomorrow. We also do paper claims tomorrow, which allows us to go from 89%, I really believe, to 100%. I think we can get there. I'm working every day to get us there. But as health minister, I want to make sure we're hitting all of our marks correctly. And I'd be happy, Vassy, to come back in a few weeks after I get a look at that information on how that program is working before I give you kind of a clearer timeline on exactly when we're going to do it. What I can say is that it's going to be as soon as possible. Once I feel that those pieces are in place and that we've got things like re-enrollment and these pieces around pre-authorization, predetermination, and paper claims working right and really firing on all cylinders and really delivering care for people, then I want to, as soon as possible, make sure that we expand those cohorts to everybody. But it has to be iterative, and we have to be very careful, because if we get it wrong, then we're going to invite, what Poilievre wants to do, which is to toss the whole thing in a garbage can, and you're going to have seniors who can't get dentures and people who can't get preventative care.
Is your sense, just very quickly, I have 30 seconds, is your sense that that will all be able to happen in 2025?
Yeah, absolutely. Yeah, and as quickly as possible in 25.
As long as you get that NDP support, right? Because remember, Duclos threatened the NDP if they pull their supply of confidence. But, well, here's the thing.
It doesn't matter.
We already know that the bloc is gone.
No, but I mean, if those 24 rebel MPs in the Liberal caucus decide either to abstain or to vote non-confidence against the government, it's all over.
Yeah, you're done. You're done. So put it this way, even the Liberals, the Liberals who support Justin Trudeau, they don't believe that an election is going to occur in October of next year. They don't believe it's going to go that long. It can't. The NDP, for all their strategical ridiculousness, they can't wait until October of next year. Like, their party is going to be decimated as it is. If they wait until October of next year, they will have no seats. None. Because their voters are going to say, what's the point? Remember, that's what their voters were saying in Elmwood Transcona, right before the by-election. That's why Jagmeet Singh ripped up the agreement.
I guess he taped it back together.
So congrats. You won a by-election. And you've gone back to supporting the Liberals, and you are now destroying your reputation. This is actually worse for the NDP that they've done this. Because everyone sees, okay, so you didn't mean it. So now we can't trust anything you say. Congrats. But again, the Liberals keep saying this, Poilievre's going to cut this, he's going to cut that, he's going to cut this, he's going to cut that. There's only two things now that Pierre Poilievre has said that he's going to cut. One is the Housing Accelerator Fund, and two is taxes.